COVID-19 is presenting such big challenges to doctors and scientists. There's still so many unknowns about how that coronavirus behaves.
KOMO's Abby Akoni is live in Seattle. She talked to a local doctor about what we can expect in the months ahead. Abby?
Hi, Mary and Eric. The doctor that I talked to today says that the death rate with coronavirus could drop over the next couple of months. However, it's likely that the overall number of cases will actually increase. It's tough to say exactly what COVID-19's next move will be. One thing we do know, beating this disease will take time.
A lot of people are concerned, and their anxiety can just rise up so much so that it can almost be like a panic attack about it.
Anna Safavi lives in Kirkland. She's concerned seeing her neighborhood hit hard by coronavirus.
We are going to get through this. It's just the uncertainty of how long this is going to last and what the next couple of weeks really look like.
I asked former UW professor and Dr. Anne-Marie Kimball about how coronavirus could behave in the future.
I don't think you'll ever eradicate it. It's probably not eradicable like smallpox or something like that.
She says some viruses subside in the summer, but that doesn't mean the same will be true for this novel coronavirus.
When you see the seasonal flu in the North American area, above the equator, and then you see it in the southern hemisphere. I mean, it literally follows the seasons very exactly. We are not at all sure that coronavirus will do that.
Some experts like Dr. Kimball say even if cases of COVID-19 drop in the summer, it could make a comeback. Could it be possible that it would resurface in the fall or next winter?
That would be possible too. I mean, honestly, I don't think anybody has clues to that at this point. We are vigorously studying in all different kinds of fields.
Dr. Kimball underscored something extremely important. Experts can't definitively say how coronavirus will move or behave in the next couple of months and beyond.
Trump has been using the term Chinese virus at press conferences and in tweets to describe the COVID-19 pandemic, which some see as racist. KOMO's Suzanne Fawn is live with reaction from community members around Seattle. Suzanne?
Well, around the world and locally, health leaders have gone the distance to try and emphasize that the virus has no race and no ethnicity. Now, the president's comments have raised a lot of criticisms online and in our community. We spoke to Sam Louie. He's a therapist who works with many multicultural clients, especially in the Asian American population. He's also an author and a former journalist.
You're literally targeting a Chinese population as someone to blame, and I don't think that's what's called for in this day and age when we're dealing with a pandemic. As Trump continues to call it the China virus, it distances and blames the Chinese for this, and I think it's just unconscionable.
Louis said the issue upset him so much he wrote a blog post about it. He believes many Asian American people are being scrutinized more than non-Asians when they're coughing, and he says that's troubling. Back here live now, we've reported in the past how business here has taken a nosedive in the Chinatown International District. Now, that was at the beginning of the coronavirus. People were afraid to shop here and visit here. Coming up at 6, we'll hear from a local leader from the International District, what she's saying about the president's comments.
CHI Franciscan Health is not only screening patients, but testing for COVID-19 too. Walk-ins are welcome here at their Burien Medical Pavilion and at 10 other triage centers at Franciscan facilities. The triage centers are typically for people with moderate symptoms and risk factors, including chronic disease, pregnant or over 60.
We recognize that this is our time to really help the community.
Medical staff meet patients in a perimeter area of the building or even outside to assess. It's their new normal in the age of coronavirus.
It's a different kind of energy.
But most people are directed here to their online portal.
Are people taking advantage of this?
It's telemedicine, their online virtual urgent care visits. Since the outbreak, Franciscan has screened 10,000 people and performed 300 COVID-19 tests.
We've been trying to ramp up as much as we can, but as you can imagine, with all of the unknowns of how much supply we have.
You've got about a 3-day supply of test kits left. What do you do after that?
Hopefully we'll get a replenishment in the next couple of days.
What's happening inside the Hansen family's home in Puyallup is playing out all over the country.
She wants to go hang out with her friends.
Both Mackenzie and Sawyer Hansen arrived home from college on Monday night after their schools closed classrooms because of coronavirus. The problem is, they say their friends are failing to follow social distancing recommendations, and these two young adults just want to be with their buddies. But Mom Heather Hansen says, no way.
She said, if you walk out that door, you're not coming back.
Bellingham-based teen life coach Jamie Shannon says she's hearing from so many parents that teens and young adults are struggling to follow the new guidelines.
It's very natural that teens are being drawn to their friends right now. But it's super important that as the adults, we draw the line in the sand and we say that this isn't optional or best practices anymore. Isolating ourselves in our home is becoming a matter of life or death.
Shannon encourages parents to give their sons and daughters the comfort and support they're seeking from friends. She points to Italy's battle with COVID-19 and the gift of hindsight provided to all of us.
All you have to do is go to the internet to watch video after video of moms saying, I wish I knew what I know now 10 days ago.
Moms who'd wish they'd stop their kids from carrying on with typical activities during days that are now anything but normal.
Right now, we can still be preventative, but if we don't all work together and do our part, it's going to be terrible.